May I then invite the board, please, to move on to the next item, which is the finance report. Paul?
Thank you, Malcolm. So the report in front of you sets out the latest financial performance data for the commissioning system as at month 11, and indeed our forecast for the year, which draws to a close tomorrow. The numbers are fully in line with the expectations I've set out in my last few reports to the board, and the time, frankly, to intervene in financial delivery is pretty much over, so I'll keep this report very brief. As we've reflected before, this has been a year of very significant operational and financial challenges for the NHS as a whole, and certainly the commissioning sector in particular. But I'm pleased to say, as the report does, that barring any last-minute accidents, we do appear to be on course to deliver in full on our commitment to generate the 800 million of system reserve needed to offset risks across the NHS. This policy has clearly turned out to be very necessary. Whether it turns out to be adequate to secure balance across the NHS will, of course, now largely be determined by the final performance of the provider sector, whose forecasts are currently hovering in a tantalising range around that 800 million mark. So just turning briefly to the numbers in the report, I'm pleased to be able to confirm that the year-to-date position is now a marginal underspend overall, that the core forecast for the commissioning sector as a whole, before the impact of releasing the 800 million reserve, remains at break-even, and that the risks to the delivery of that break-even position have continued to reduce steadily from over £500 million at Q1 to nearly 300 million at the half-year point, 148 million at Q3, and now 34 million in the report you have in front of you. We will, of course, continue to work on mitigations to close out the remainder of the risk, and I have a reasonable line of sight to doing so at this stage. The report sets out all the rest of the detail on the position, but as there is nothing very different from the last time we went through all of this, I wasn't proposing today to add further comment at this point. Clearly stand ready to discuss any aspect of my report with the board.
Thank you very much, Paul.
An observation,
David, please.
Clearly, we have the commissioning sector having very high levels of efficiency ask this year in order to fund the 800 million contingency reserve. That's reflected in, I think, the CCG numbers in terms of where they stand. Now, the balance this year has been done by some very effective and good management and some difficult trade-offs within the central management, the NHS England budgets, if you like. I think it's also worth pointing out that Specialised, which has done really well in terms of its position and, again, good management. I think the observation, Malcolm, is that past performance is not a good predictor of future success, and therefore I think it's really important that everyone recognises that the same approach to managing the aggregate budget for the year coming is just not as realistic, and therefore we should be very thoughtful going into the planning rounds, or not the planning rounds going into the year, that we have much less flexibility to be able to pull levers in the centre of NHS England to be able to offset challenges elsewhere, and therefore the importance of the integrity of the operating and financial plans that are being finalised at the moment, their realism and their the support in terms of actions that people are taking to deliver outcomes is really critical, and the risk therefore is higher than it has been.
I think absolutely right, David. Joanne?
I just wanted to say a word about CCG audit chairs, because I think the financial achievement that's been looks like we will get to this year is not in no small part due to the really tough decisions and the hard work that is being done at CCG level. And as we know, CCG audit chairs are lay people who give up their time, take an enormous amount of responsibility on our behalf, and we meet with them a couple of times a year to try and support them in their role. I think they've done a fantastic job, and it would be good to recognise that.
Yes, thanks. Well, I think we just need to, first of all, commend the work that Paul and his team have done with the CCGs, including their audit chairs. Secondly, to understand actually there's still quite a lot of work to do to close the position for this year, and each year it gets tighter and harder, and games may be played. It's really important for Paul and his team to be able to settle that down and get a final figure as soon as we can. And then thirdly, to note David's point that next year will be worse. We say that every year at this time, but we know actually the coming year and 2 years are going to be very tight financially. So we commend Paul for the work that you've done, and we will need from an even earlier stage in the coming financial year to be completely on top of the finances. But thank you again. Right. May we then move on to the next item? I just need to check with Jane. I know you need to leave early, but are we okay for your timing so far?
Yes, fine.
Okay. That was with a view to perhaps bringing her reports further forward. But let's then move, maybe, please, to emergency preparedness, resilience and response. And Matthew, the report's in your name.
Thank you very much. Yeah. So I guess it's first worth noting that if the Civil Contingency Act kicks in, then NHS England takes control of the NHS's resources. So that's why this board has taken interest in this. And in the past year, the accountable officer responsibility has passed to me from Richard Barker, who was acted into this role as an interim and has now gone back to being the regional director in the North. So thanks to him. Anne Rainsbury, who's the regional director for London, continues to be our national strategy and is the incident director for a national incident. Simon Weldon, who recently started as my national director for ops and delivery, has day-to-day responsibility, and Stephen Groves is the national head of EPPR. So we have an infrastructure that runs through. There's a requirement for this board to receive reports at least annually. So this paper is so you can note the progress that we've made in the past year and receive assurance that the NHS is focused on this issue and has the right pieces in place. And then, subject to your agreement, this paper will be used to inform the NHSE annual statement of assurance to the Department of Health. So in the past year, we've conducted, as we always do, assurance of the readiness of the regional structures and the CCGs to deal with an incident. We've done deep dive reviews on business continuity and our preparedness for a fuel disruption incident. We've participated in the Department of Health-led exercise Cygnus, which was a 3-day exercise on the potential impact of a pandemic flu outbreak. And we have responded to a number of real incidents, from the BMA Junior Doctor Industrial Action, where we were working to protect the emergency care pathway, to an E. coli outbreak in June, which we worked on with Public Health England, to the Croydon tram derailment in November, where sadly there were a number of deaths and some injuries, and of course last Wednesday's attack on London. And we're currently now going through the exercise to learn what we need to from that incident in order that we're better than, next time, although that it ran from the NHS point of view, it ran very smoothly, and the plans fell into place. Next year, alongside our other work, we'll be continuing to ensure that NHS England staff are appropriately trained and that the plans are in place for response where necessary. We'll be finalising work on the NHS response to a mass casualty incident, and we will be ensuring that we have the capacity and capability in place to respond to major incidents. So, subject to questions, I hope you'll accept this report and the assurance that goes with it.
Thank you, Matthew. Well, let's take some questions. Joanne? Oh, I thought you were. No, I just wanted to make sure that everybody's had the opportunity to see the EPRR headquarters and to get a sense of the organisation and the necessity of running something the whole time that for much of the time doesn't seem to be doing anything, but at a critical moment can switch into really high-level performance, take gold command, as you say, and provide safe outcomes. Actually, just last Wednesday morning, I happened to be at the Transport for London control centre with exactly the same capability and with a very interesting model in which the police are integrated with their whole surface transport model. And again, a command control structure which allows them to respond in parallel with the NHS in a major incident as tragically happened that same afternoon.
Yes, I mean the thing you have to deliver in these incidents is the integration between
Yes.
the public services. I was in the control centre when we had the London bombs, and the link between ourselves, the fire services, the police services, transport, is crucial to be able to create a coordinated response in order to be able to stop the train so that the paramedics can get onto the track, get the electricity turned off. Those sorts of things are crucial integration. And some of the things we planned for, like pandemic, we're looking beyond just an England response and to what is a United Kingdom response. So those are the reasons that we run simulations and we do the training and that we have the facilities on standby for when we need them.
Okay, Joanne.
I just wondered, when we have the kind of emergency that requires a contact centre, who provides that these days?
That's provided through 111.
Right. Well, thank you for the
Thank you.
report, and I think we take assurance from that, and this is the function of this regular report to the board, to be assured that we're actually doing the business. I think the thing that should give us most assurance is the fact that after each incident we do a learning process from it. We learn also from other incidents, the Romanian nightclub fire that you mention in your paper.
Yes.
So that to try to ensure that our service is ready for action whenever it's called upon, which by definition is completely unpredictable.
Indeed.
Right. Well, thank you very much for that.